Hi guys, my name is Alexander Hetrick. I'm a fourth year with Rocky Vista University. I'm a part of the Global Medicine track and also founder of the Wilderness Medicine group on campus. And I've also participated in the AWLS courses with the University of Utah in their Wilderness Medicine group. And I have certifications in AWLS and backpacking medicine with them. So that's kind of where this is coming from. So today I want to talk to you guys about Sea to Summit medicine. So we're going to be encompassing four big topics this round, which include drownings and how to save drown victims, diving medicine, high altitude medicine, and avalanche safety. So they're going to be divided into four separate videos, and all of these are just supposed to give you a general overview of these topics. Again, you should always participate in a training course where you can get some hands-on experience with these subjects before actually enacting them out in the wilderness. So this is just to give you a brief overview of what you should have in the back of your mind. And yeah, so I am giving this talk for the Global Medicine group because when you're going on outreach trips abroad, often you're going to some pretty remote areas for giving medical care, but these areas often coincide with popular tourist destinations for outdoor activity. So all of these should apply for wherever you're going. So with that, let's go ahead and jump on in. So we are going to be first talking about drowning and rescue. That's what this video is going to encompass. The topics within this video include drowning, water rescue, drown victim resuscitation, hypothermia, cold water immersion, and rewarming therapy. All of these topics are taken from either the Auerbach Manual of uh, Wilderness Medicine or from the AWLS Manual of Wilderness Medicine from the University of Utah. So those are the sources for all of this information. So drowning is the third leading cause of death worldwide, with estimates of 360,000 deaths in 2019. It's the top five cause, one of the top five causes of death in children 1 to 14 years old. And risk factors for drowning include drug, alcohol use, with 80% of deaths being males, whatever you want to extrapolate from that. Trauma from water recreation secondary to dives, fall, and horseplay is a super common precursor to drowning. And surprisingly, failure to wear a PDF while boating leads to 88% of drowning deaths from that 360,000 statistic. All of this coming from the updated 2020 manual of wilderness medicine from the University of Utah. So this is a super predominant issue throughout the world. And no matter where you're going for your medical outreach, this is something you should be aware of and also be versed in. So if you are taking care of drowned victims, you know what to do. So let's talk about the drowning process. First, the victim usually becomes panicked. So someone realizes they're drowning for whatever reason. Either they don't know how to swim, got pulled out too far, were caught on a riptide, whatever. They're going to start becoming panicked because they aren't able to keep themselves above water properly, or they're freaking out basically. When they become panicked, they start hyperventilating, so they're increasing the respiratory rate. The second part of this process is that at some point the victims are thrust underwater, so they're not able to properly tread water, so they keep getting dunked under. And when they are dunked under, they have to hold their breath. When they come back up, they start hyperventilating again. So this entire process is lowering the oxygen levels in the blood while increasing CO2 levels in the blood because of these breath holding spells, using more musculature to try and ventilate yourself. And overall, the victims start getting hypoxic and hypercapnic. So as the victims struggle to stay above water, they're using more oxygen because they are frantically doggy paddling or just trying to shove as much water under them to keep themselves up. So they're using quite a lot of musculature to do this. They're using a lot of their oxygen reserves to do this. Again, the PaCO2 in the blood is rising as the PaO2 is decreasing because of oxygen use from that musculature use. As this PaCO2 rises, the medulla in the brain is stimulated, causing involuntary respiration. So remember, these victims are constantly being dunked underwater because they're not properly able to tread water. And if you're suddenly getting the respiratory drive in the brain stimulated, saying, hey, you have to breathe, when the victim is dunked underwater, then they're taking inhalations of water. So as the victims inhale water to their lungs, this can cause pulmonary damage. It can cause constricture of the larynx. Um, and this all kind of just keeps going down the path of hypoxemia. Hypoxemia eventually leads to secondary organ damage, which you can start getting cardiac ischemia, leading to arrhythmias. You can get respiratory acidosis, which can also induce arrhythmias. Then you start getting some inflammation and cerebral edema in the brain, which eventually cause neurologic injury, eventually completing the drowning process. So overall, this is the process that drown victims go through and how their body eventually shuts down. But essentially, there are two pathways that lead to death in drowned victims. So, the immediate physiological response to drowning is breath holding. After breath holding, involuntary laryngospasm can occur with the entry of any kind of fluid into the oropharynx. So even though they get dunked underwater and they start these breath holding spells, often they do get a certain amount of water going into the oropharynx. This water can induce laryngospasm, in which the larynx kind of constricts down and nothing's getting past it. No water's gonna come in, but then you also aren't getting any air coming in as well to the lungs. This leads to the first pathway of death, which is asphyxiation or involuntary laryngospasm. Any kind of fluid can induce this. Salt water actually induces it more often. But you should just basically understand that if any kind of water enters the oral cavity and goes down to the pharynx or larynx, it can induce that laryngospasm, causing them to choke to death. So if laryngospasm doesn't occur, if that water doesn't induce that choking, then you have the risk of the water going past the larynx and down into the lungs. And this is aspiration, the second pathway to death. So as the person is being dunked underwater, they're slowly getting more and more hypercapnic, which is inducing the respiratory drive to say, hey, take a breath of air. If that person's underwater or not treading water appropriately, they can be getting more and more water being aspirated into the lungs. Eventually, this will fill up the entire alveolar space in which they're not getting proper oxygen diffusion across that alveolar membrane, eventually leading them to further their hypoxemia and eventually pass out and die, basically. So, just overall, from what we've talked about, I just want you to take away that the drowning process induces the victims to become more and more hypercapnic, which causes the blood to become acidic, inducing the respiratory drive to induce individuals to take a breath. Eventually, this leads to collapse of the airway, either through asphyxiation or aspiration. Then the individuals get extremely hypoxic, they pass out, and then they get secondary organ damage, either cardiac or neurologic, which eventually kills them. So that's the overview. So moving on to kind of some ways things have changed in the past couple of years. Drowning terminology has changed a fair bit. We no longer use the terms near drowning, wet drowning, dry drowning, any of that. It's been simplified down to drowning, immersion, and shallow water blackout. So the drowning process is basically respiratory impairment due to airway being immersed, to which the patient then dies because of that. The process can be interrupted at any point by rescue or resuscitation. Drowning specifically means respiratory impairment from submersion or immersion. Submersion being underwater, immersion just being surrounded by water. And you kind of wonder, how can someone drown if they're just surrounded by water, if they're not underwater? Well, waves and such kind of crashing over individuals, in which circumstances leading them to aspirate more and more water that eventually leads to the drowning process. Again, immersion is just to be covered in water, while submersion is being completely underwater. And then another term you should know is shallow water blackout, which is hyperventilation before going underwater. It's often practiced by free divers to increase their dive time. So taking a bunch of long, deep breaths very quickly. To induce hyperoxemia in their bloodstream, also hypocapnia. Um, but the hypocapnia, reduced respiratory drive, can cause the victim to pass out while immersed because they don't have that respiratory drive to tell them, hey, take a breath. Um, the hyperoxemia can also cause blackouts when you have oxygen levels that are too high. It's called oxygen toxicity. So that's something you want to be careful with free divers. But again, you remember what we just talked about. People who are drowning are panicking, and so they're going to hyperventilate themselves, and so they can also get these shallow water blackout episodes. All right, so signs of a drowning victim. Is something you should be aware of whenever you're at the beach or river or whatever. If you see someone with these kind of signs, notice that they're not properly treading water. They could be drowning. So some of the signs are drowned victims are usually facing towards shore. They are able to orient themselves enough to get them towards what they assume is going to be their preservation, which so they're going to go towards either the nearest landmass or towards the nearest boat that they see, and they're going to orient themselves towards that direction. You'll see their mouth at water level, but their head is going to be tilted back, so their mouth is going to be as pointed towards the sky as they possibly can get it. Their body will be vertical, so they won't be laying on their back, and they're going to be climbing a ladder motion or a doggy paddle, just trying to tread water in any way possible. It's going to look very disconcerted, and you're going to kind of just know instinctively, hey, this person is in trouble and not doing well. So these are the general signs of drowning. Okay, so let's talk about water rescue. So rescuing someone once you notice that they are drowning. So the first thing you should do when performing a water rescue is stop and look at the surrounding scene. Why are they drowning? Just don't assume that they're drowning just because they don't know how to swim. Immediately suspect that there is something in the vicinity in the water that induced their drowning episode and could induce your own if you go in after them. So you want to make sure the scene is safe and not create a second victim. You don't want to put yourself at risk and make it where you're drowning as well. So some of the dangers we're talking about: swells and tides, especially at the beach, people who get caught out in rip tides. If you try to go save them, you're going to just get caught yourself. And then you have two victims out there that need help. So you want to be very careful in oceanic conditions. Whirlpools, especially in rivers or on beaches with a lot of underwater coral and that sort of thing, can cause someone to either get pulled out further into the water or be stuck in a certain area of water and continually dunked under. You want to be aware of any rocks in the area. So if you're in an area for cliff diving, you notice someone drowning or not moving in the water face down, you want to be looking around to see what they may have hit as they went in, especially if you're going to have to jump in from a distance. A distance down to get to them. You want to make sure you're not going to hit whatever they hit. Cold water. So winter conditions, we'll talk about this more later, but cold water, you do not want to go in yourself. We'll talk about why later, but cold water rescue, often rescuers turn into the victims as well. And these are very serious things to consider. So we'll talk about this more later. And then also kind of looking at other conditions. Okay, if I jump in after them and I pull them out, do we have gear to get warm? Do we have a way out of here? If you're in colder conditions, again, even if you get the person out, you can both get hypothermic and and be incapacitated that way even after getting out if there's strong winds, cold air, and you don't have a way to get warm after. So you just basically need to take away that if you are going to perform a water rescue, you need to make sure that you are yourself not going to be victimized during this process. Okay. So the next thing you need to do is basically call out to anyone uh, around you that something's happening. So if there's someone else on the beach, you need to make sure they're paying attention when you dive in to rescue someone. If there's no one on the beach, then you need to call someone if there are any kind of dangerous conditions going on. You don't need to jump in alone, try to be a savior, and then have no one coming out to save you if you also get out into this situation. Um, then you need to take a look around you and see if there are any kind of floaty, floaty devices around you that can help you with your rescue. It is really hard to rescue someone and pull them back to shore. So if you have any kind of flotation device around you that you can use to assist you, that can be a lifesaver. Okay, so water rescue. All right, so we have talked about one, scene safety, two, call for help, three, find a flotation device, four, this is you actually going to the water if you've determined that it is safe to do so and you have called for help. So the goal is to bring the victim's mouth and nose above the water. This is actually harder to do than you think. For a couple of reasons. So first, you're approaching the victim from behind, if possible, with a buoyant object in tow. Um, so basically, approaching them with floaty. People who are panicking will often not be in their right mind when you approach them, and the immediate thing they do is cling on to you and try to use you as a flotation. And in which they keep pushing you underwater and can induce you to drown. So it's pretty dangerous. They aren't doing it intentionally. This is a panic response in which they are actually essentially attacking their rescuer, pushing them under, trying to use them as as leverage to get above the water. This can be incredibly dangerous. So again, this is just to give you a mental idea of what's going on. You need to be a part of a training seminar if you are going to perform water rescues regularly, because this is something you need to practice. So first, try to approach them from the back where they can't see you, if possible. If they're facing towards shore and you're coming from shore, that's going to be hard to do. But essentially, if you can get behind them um, and keep them from twisting around and then climbing on top of you, then you can keep them from trying to drown you, basically. If you are approaching them, you can't get behind them, they see you, and then they, in turn, try to cling on to you. There's a couple of ways to do this. First, try to use their arm and quickly twist it. Uh, take it try to explain this in words. Take it from in front of them, twist their wrist down and then behind them, causing them to swivel around and turn. All the while trying to calm them with words, hey, I'm here to help you, I'm going to help you, and just repeating that someone is there to provide aid. So basically what you're trying to do is twist them around so again they can't climb on top of you, and then if you have a floaty device, trying to wrap it around them as much as possible. If you don't have a floaty device, try to wrap your arm around their chest and bring them onto their back so that they stop flailing and you can slowly calm them down. Putting pressure across their torso with your chest against their back and putting quite a lot of pressure can slowly bring them out of that panic mode. Basically, that the applying large areas of pressure decreases the sympathetic response and can help calm them down enough, and to which you can hopefully talk them out. Hey, stop struggling, stop moving. I'm going to help you. I'm not going to let you drown. We're going to pull you out of here. Just I need you to calm down so I can get you out of here, basically. So what happens if they start climbing on top of you? You aren't able to twist them around or um, get them off of you, what you do is you dive under basically. So you push off towards their chest where they're going to be climbing on top of you. Push off their chest downward so that sends you underwater. Dive underneath them. And then try and come up behind them if possible. If not, try to come up a ways away from them and do the whole process again and try and try to do everything we talked about. They will not keep clinging onto you if you're heading underwater, especially if you're able to push away from them and push away from their arms underwater. Um, so the idea is, again, you want to bring the victim's mouth and nose above the water. Um, so your priority is towing them on their back. So you want to get them on their back and then tow them to shore while keeping their mouth and nose above water. If they're conscious, it's a little easier to do because they're able to help you a little bit. Again, this is a key area where having a flotation device can really save your butt because you can put that underneath their back and assist in keeping their nose above water. Often, what rescuers who are inexperienced will find is they put their arm around the victim's chest, towing them on their back, but what they're doing in the process while they're treading water and trying to get to shore, they're actually dunking the victim's head underneath. Which, if they're awake and they're freaking out, they're going to keep you from doing this, and you're going to have a tough time getting to shore. If they're not awake and you're not paying attention, you can actually facilitate the drowning process if you're not careful. Um, so if they're conscious, again, the flotation device is really key there. Otherwise, taking it very slow, keeping them on their back, having them take deep, full breaths and holding to create a flotation out of their own chest, if you can. If they're unconscious, what you can do is instead of grabbing them around their chest, float them on their back, create a C shape with your hand, put it underneath their jaw, and then use that to hold their jaw above water rather than trying to hold them by their chest as you're as you're treading back to land with your other arm. Um, Okay, so once you're on land, so there's a couple things to know. First, if there's someone there to assist you, if it's on a beach, the first thing I want you to think of is yelling out towards whoever's on shore, hey, can you find something hard to put under their back? Often, if there's a lifeguard tower or something close by, they'll have the full backboards and whatever. So if you can get them onto that while they're in the water, that can help quite a bit, especially if this is a victim who possibly suffered some traumatic injury from cliff diving or the sort, because you don't know what kind of injuries are happening underneath. It's a lot easier to flip someone onto a backboard while they're in the water than it is to on land. So again, that isn't a huge deal. It's not a priority if they're not breathing. Don't wait in the water for someone to get something. If you're going to have to wait. But it is something you can keep in mind if you do have multiple helpers around and there is something available immediately. Um, if there isn't something available immediately, there's someone to help you. Have them come into the water and help you pull the victim out. You want to pull them out onto shore um, and essentially into an area where you can have something hard underneath their back. So whatever you can find around you that can be a hard surface, get it, because if you do have to eventually do chest compressions, you want something hard underneath their back. Otherwise, you're not going to get proper compressions. So you get them onto land. And then you're starting to assess them. The first thing you want to do is assess their breathing. So for those of you who have taken a wilderness course before, you kind of know about the March criteria. March, M being massive hemorrhage, A being airway, R being resuscitation, C being circulation, and H being hyperthermia or other. We changed this a little bit for drowned victims, and we start with airway and resuscitation, or airway and respiration, sorry. Because even if they have a massive hemorrhage, if they're not bleeding, if they're not breathing, sorry, if they're bleeding but not breathing, breathing takes precedence. So someone who's not breathing and bringing to shore, you're also going to do resuscitation a little differently. So someone who's a drowned victim, even if they don't have a heartbeat, you start with rescue breath. That kind of is contrary to the current CPR guidelines for regular CPR, which for regular victims who don't show circulation or respiration, and that you're assuming that their lungs are waterlogged, and that's what caused the arrest if they don't have circulation. Uh, Often, individuals who you pull out of the water won't be breathing, but they'll still have a pulse. So again, that's why you want to start with rescue breaths. So you start with 5 deep rescue breaths for these victims. Most drowned victims in respiratory arrest will respond within 2 breaths. If they've had complete circulatory collapse and also respiratory collapse, then you may have to do the 5 rescue breaths and then start traditional CPR, which the new 2020 guidelines from the Heart Association do state that we are no longer doing rescue breaths in between the 30 chest compressions. And that holds here. You do the 5 rescue breaths, and then if they don't have circulation and they are not spontaneously respirating, you start CPR and just start pumping on their chest and keep pumping for the next 15 minutes or so, or until help or a assisted defibrillation device arrives in which you can attach to their chest and figure out what's going on underneath. But essentially, 5 rescue breaths, start chest compressions. If you don't get them back within 15 minutes, it's a lot less likely you're gonna get them back at all. So just kind of keeping that in mind, especially if you're in a dangerous area that you have to vacate quickly. So that being said, let's go over a couple of water rescue techniques.
For the submerged unconscious victim, gain control, exposing his airway. Grab your Peterson tube, put it around his back, wrap it around the front, clasping the metal clasp to the ring, cross chest carry, and swim to safety. Again, a submerged unconscious victim using the forklift technique this time. Gaining control, Peterson tube around his back. Maintain control of the victim. Clasp the metal clasp to the ring. Cross chest carry and swim to safety. When approaching your victim, make sure you keep a safe distance while assessing them.
Good. Let's do 2 hands.
Top.
If a victim gets a hold of you, the best way to get away from him is to go deeper, push away, and swim to a safe distance. When approaching a possible rescue, you want to ask a couple questions. First,
Are you alone?
are you alone?
Yes. Are you hurt?
Are you
No.
okay? If they need assistance, slide your tube to them, instruct them to put it under their arms and turn away from you. Swim to them, gain control, clasp the metal clasp and the ring, cross chest carry, and swim to safety. When approaching a victim who is conscious and frantic, sometimes all you need to do is send them the tube, have them hold on to it, keep your distance, and drag them to safety, trying to reassure that everything.
Okay, so that's all within pretty much ideal conditions. That was just to kind of give you a sense of what we've been talking about of how to get people out of the water and start rescue attempts. Again, these people are going to be a lot more frantic than in this video. And so I do really recommend doing a water rescue course in which you're actually in the water practicing these techniques, in which the instructors try to drown you so that you make sure you know how to handle such a situation and you yourself do not panic. All right, so this has all just been kind of a general overview. Let's talk a little bit about what you do in river situations. So river rescue could be its own course entirely. It's extremely complicated. If you're going to perform river rescues, you really need to make sure you do a river rescue course because this can be a very dangerous situation for the rescuers if they're not doing it properly. So this is just to kind of give you an overview of what's going on in these situations. So someone falls out of river raft or their kayak or whatever, they have a flotation device on, hopefully. Um, and if they're conscious, then you want to yell to the victim to float on their back and then point their feet down current. You don't want their feet sticking out of the water. You want their feet a foot or two underwater, but pointing down toward down current. The goal of this is for your feet to hit any kind of big rocks first, um, so that it doesn't hit the rest of your body and kind of shoves you around the rock. If your feet are out of the water, the rock's going to hit your butt first, and that can also cause some spinal trauma. So you want to make sure the victim's feet are still in the water. Um, if you have a bag rope or a flotation device on hand that you can throw to them or throw near them, make sure they're looking at you. Yell to them, hey, I'm throwing this flotation device. Grab onto it and do that. Even if the flotation device isn't hooked on to something else, giving them something else to float with, especially if they don't have a life jacket on, can help them quite a bit. So there's essentially three big ways you can do river rescues. The first is the one we've already been talking about, is bag throw, of which you're throwing a bag or a flotation device attached to a rope to the victim and then able to pull them back to shore. You want to make sure that you have more than one person, or you have a tree or a rock or something to tie the rope to, or sling the rope around, so that you yourself aren't pulled into the water, because the weight of the victim and the weight of the current can pull you off ashore pretty quickly. Um, the really good thing about this is you often don't have to drag them back in yourself. Is that once tension is put on the line, you from shore are actually going to swing that person on the end of the line towards the edge of shore once the current starts taking them further. If it's a super deep area, there's no shore to catch onto, it's just rocky cliff face or something, then you can pull them in slowly, but often just being able to swing them around to shore can get them out. The second type of rescue is called entrapment, is where you have two teams. You both are running downstream of the victim, trying to get ahead of them. Then you throw a line across to the other team. You have teams on both sides, and you create a line across the entire riverbed, in which when the person kind of comes up to it, hopefully they are conscious, and you can tell them, hey, grab the rope. They'll grab onto the rope, and then both teams will be able to kind of lasso them in the middle of the river and then slowly pull them to one side. Um, Again, you want to have either multiple people in the team, have it tied off to a tree, something, because this is a lot of weight from the river and the victim that can pull both teams in if you don't have a strong enough hold. Um, the third type is a tethered rescue, which I really do not recommend any of you doing this unless you've taken a proper river rescue course, because this can be quite dangerous, can create another type of victim. Again, we're talking about rocks, whirlpools, all sorts of stuff with rivers. It can be quite dangerous. But this is essentially when someone dives into the water to rescue another victim. Again, having proper safety equipment on themselves, a helmet, life vest, and the rope is not tied to the tethered rescuer. It's actually they're holding the rope as they go in, because if you tie it to the rescuer and the current is too strong, too swift, it can actually pull the rescuer under. Because you have them tethered, it basically acts as a deep water fishing lure, in which it kind of drags them under the water, keeps them towards the bottom where they can't get back up to surface. And you can actually drown the rescuer that way. So you want to be careful that you do not tie it to the person. They're just keeping it with them, so that they can create a lasso around them and the other person once they're sure they're not going to be dunked under. And then uh, you can either tether them where they are pulled to shore from from the middle, or you slowly pull them in yourselves as a group. So that's just kind of the essentials of river rescue. Again, this could be its own course entirely. So I do really recommend taking one of these courses. Ice hole rescue. So this is kind of what we were talking about earlier with people who are doing cold water rescues actually becoming the victim themselves and drowning. Ice hole rescues or ice water rescues, frozen lake rescues, anything that has to do with freezing temperature water can be extremely, extremely dangerous. Basically, what happens is once you're in cold water, you're basically shutting down all muscular function within 5 to 15 minutes. So immediately you're going to have a cold water immersion reaction, which we'll talk in a bit. But this causes you to take deep inhalations, which can actually cause you to inhale the water and then starting the drowning process. And then the cold actually starts making it where you have extreme muscle rigidity very quickly, and then eventually being completely incapacitated in 5 to 15 minutes, depending how cold the water is. So people who jump in after a kid or a dog or whatever to rescue them out of freezing water actually aren't able to get out themselves after they get in because they can't properly use their muscles. They can't properly latch onto anything to get out, and eventually end up drowning themselves along with the victim. So, when you see someone drowning in freezing water, if the first thing you want to do is try to throw something to them, whether it's a rope, a flotation device, something that they can hold on to. If you can pull them out with that, great. But if you can't, then at least you have something that when their own muscle function completely shuts down, they're not able to tread water anymore. They at least have something to keep them from drowning. If you're in an ice hole, you can try and rescue yourself if you still have enough muscle function. So basically, you get to the side, hold on to the side, kick up your feet so that you're trying to get your body horizontal, and then you swing your arms trying to kick and pull yourself onto the ice. And once you're on the ice, you don't stand on it. You just slowly try to slide out as best you can because that ice around the hole is going to be very fragile, and you'll end up back in the water if you put too much pressure in one certain area. The last image on the right-hand side just kind of shows you what a professional rescue does, in which these individuals would be wearing full suits to keep them from going hyperthermic and keep their muscle retention so they're able to properly facilitate the rescue. They go in with flotation devices tying around the victim and then eventually create a lasso around the victim and try and pull them out with a team on shore helping out. And again, neither the victim or the rescuer is going to be standing up on the ice near that edge because it will collapse underneath them. So ice hole rescue, freezing water rescue is incredibly dangerous. The best thing you can do for anyone, even if it's your own family, is not jump in yourself and instead get help as soon as possible. Get ropes, flotation devices, throw it into them because you jumping in yourself isn't going to help them. It's just going to create more of a problem for everyone. So let's talk a little bit more about self-rescue when you're not in an ice hole where you're kicking yourself out and trying to latch onto the side. So self-rescue in open water, especially cold water, there's kind of a pathway to think about things. This is for your own personal use. So accidental cold water immersion, you're trying not to panic, trying to keep your breathing under control. Again, when you first get dunked under cold water, you're going to be taking deep breaths. It's going to cause a full body paralysis really quickly. So you're trying to not panic and make proper decisions. So if you have a PFD on, personal flotation device on, you have two pathways. The first is you're assessing, is a rescue possible? Did someone see you fall into water? Is there someone you can call out for help to? Is there a boat nearby? If so, stay where you are, conserve your movements, and wait for them to rescue you, making sure that, hey, they notice you. Hi, help, basically yelling out as loud as you can. And once you know that they have seen you or are going to attempt to rescue you, then wait for them to rescue you. The second option is, hey, rescue's unlikely. There's no one around. No one saw me fall in. I don't see anyone that I could call out to. then you're going to estimate time to swim to safety. So whether that's a beach, a shore, a boat, whatever, estimate how long it's going to take you to get there. If it is more than 45 minutes, what you guesstimate, then stay where you are. If it's going to be a long ways and it's going to be longer than 45 minutes by your estimation, then you are not going to make it. So stay where you are and wait for conditions to change. Again, this is if you have a flotation device on. If you estimate you can make it, it's less than 45 minutes, consider swimming. If you're going to swim, you need to decide quickly, and then you need to commit to the decision. You don't stop halfway. You just keep going until you're absolutely exhausted or you've made it to shore. Now, if you don't have a flotation device on, this changes things. If you can get something buoyant to hold on to, whether it be a boat, piece of wood, flotation device, whatever, then you stay where you are, and then you can do the reassessment according to the previous pathway once you have that flotation device. If there's nothing to hold on to around you, you have no choice but to swim. You just got to go for it and try and swim to safety. So that's just kind of the basics of self-rescue. All right, so we've already talked about a little bit about what you do when you get a person to shore. So we're going to quickly go over that and go over a couple other things. So again, we talked first, scene safety first, making sure the area is safe, and whatever rescue attempt you're going to make is going to be performed with optimal safety. Once you get the person back to shore, again, trying to make sure there's something hard under their back in case you have to do CPR, and then you start your survey. So again, we don't do the traditional Mark survey. We do airway respiration first. So see if they're breathing, see if there's anything blocking their airway. If they aren't breathing, then you do 5 rescue breaths. And then if they are still not breathing, but they have a pulse, you can continue rescue breaths. If they are not breathing after 5 rescue breaths and they don't have a pulse, then you start traditional CPR and just start pumping. Okay, so if the victim is breathing, if they're have a pulse and or they're unconscious or conscious, then you start the rest of your survey. So you go back up to the top to the March criteria. You go to massive hemorrhage. So you're looking over their body to see if they're bleeding out anywhere. So if they've been cliff diving or anything like that, you're checking for trauma. You're seeing if they're bleeding out anywhere. Then you check for their circulation, make sure they have proper circulation, and then you do hyperthermia or other, basically. So you start figuring out if there's anything else applying. During this, you're also talking to them if they're conscious, saying, "Hi, my name is Alex. I'm a 4th-year med student. I'm here to help you. I'm going to check you over and make sure everything's okay. What's your name? How did this happen? Do you remember what happened? Do you have any medical conditions? Do you take any medications? Any allergies? Last time you ate or drank something, kind of on low priority, but if you're excavating the patient and they eventually lose consciousness, it's good to have, especially for anesthesia if they have to go into surgery later on. It's also good if the patient is a diabetic to know when the last time they ate something, in case that's contributing to their situation or they're starting to develop an altered mental state. It's good to know that information. And then again, you're just wanting to try and figure out what happened, especially if there's another victim somewhere that you don't know about that you need to be conscious of. So the drowning victim patient assessment, again, starts with respiratory first. Repetition is key. Circulatory stabilization. Arrhythmias are super common in drowned victims, so you're trying not to jostle them too much. You don't want to send them into arrhythmia, and you're wanting to be quite conscious of their circulatory management. Then you do your full body assessment, massive hemorrhage. Again, cliff diving, you're looking for head and neck injuries, super common. So you're pressing along down their spine, seeing if they have any pain on palpation. If they do have any pain, then you're wanting to somehow stabilize their neck. If you have a SAM splint on you, great. If you have a C-collar on you, great. If not, use towels, anything you have on hand to try and get their neck stabilized. If you have a backboard, awesome, you can get that under them. If you have other people to help you, you can do a C-spine roll, which we have another slide coming up about that real quick. Basically looking at them head to toe, seeing if there's any open fractures or anything that is causing them to continue to get worse. Pushing on their hips, making sure that there's not an occult hip fracture that you don't know about that's causing them to bleed out. If they do have pain when you push on their hips, then throwing a jacket or something underneath them, tying it around tight, and getting a hip stabilization on them. Checking and seeing if they're intoxicated, smelling their breath to check for ketoacidosis. Anything that could have contributed to their drowning situation. And then you're wanting to strip any wet clothes off of them, especially if you're in cooler conditions or cold conditions. Stripping wet clothes off of them, dry them off, patting them, not rubbing them dry. Again, you're trying not to jostle them and not trying to stimulate them too much. So you're patting them dry, then you're getting them back into some kind of dry clothes or a blanket. And you do want to make sure you have some kind of windproof layer over them, because the wind can take quite a lot of heat off of them. All right, so talking just quickly about different kind of C-spine rolls. This works best with a group where you always have someone stabilizing the patient's head and rolling them over onto their back onto a hard surface, lifting them with several hands on both sides. Again, you want to keep the C-spine very stable while you're doing this. Always have someone at the head, and the person at the head is calling all the shots. They're the one saying when they're going and all that. Again, this is why it's a lot easier to get a patient onto a backboard while they're in the water if you can, because you can usually do that with by yourself or just with two people. So if you do have that on hand, utilizing that. If you haven't done patient carries, patient rolls, or that sort of thing, I do suggest you get with a group of friends, look up a couple of videos and learn how to do it. Okay, so you've done your assessment of the victim, you've gotten them as stable as you can, and then you start asking the question, do we stay or do we go? So any degree of drowning or drown resuscitation warrants an evacuation of the patient. So you can just fall back on that and say, any kind of drown victim, we're getting them out of there to be checked over. If you have a stethoscope and a pulse ox in your bag, that can be invaluable. Because then you can do an actual proper respiratory exam and then also see how they're oxygenating. You can listen to both lungs, see if you hear any crackles, anything that indicates that there is water in the lungs. You can also hear and see if they have gotten a pneumothorax or basically an obstruction to one side. You'll hear decreased or absent breath sounds on that side. Then you can also put the pulse ox on their finger and make sure that they are oxygenating, even if they do seem completely normal. Respiration was normal. You do want to make sure they're actually oxygenating properly. So if a patient has any kind of respiratory complaints or any exam findings on respiratory exam, you evacuate them. Plain and simple, you get them out of there. You don't wait, you just go. Some of these symptoms can include loss of consciousness, dyspnea, persistent coughing, air hunger, in which they keep trying to take deep breaths of air. They feel like they can't quite get enough. Tachypnea, so again, taking very quick breaths. If they're shallow breaths, that's something to be concerned about. Or anything abnormal in pulmonary exams. So rales, wheezes, rhonchi, anything that sounds abnormal, diminished breath sounds on one side or in certain lobes, or hypoxemia on pulse ox. All of these things, if you have even one of these things, you evacuate the patient, you get them to emergency center to be properly evaluated. So patients who are asymptomatic when they come out of the water, they're doing great. They have a complete normal exam after maybe coughing a little bit. They're totally fine. Then you can consider staying out in the backcountry. If you're on a camping trip or something like that, you can consider staying longer and then reassess them after 6 hours to make sure that they are stabilized and they have no exam findings that are coming up later. Then you can consider not evacuating. So when things go bad, some factors that indicate a bad prognosis for drown victims. One is that they are less than 3 years of age. So young children often have worse outcomes. Submersion or immersion, greater than 5 minutes, they've been in the water for long periods of time. Um, that they've had no resuscitation after respiratory circulatory collapse after 10 minutes, and they still haven't had resuscitation. Comatose upon entering the emergency room, or pH less than 7.1, so they're extremely acidotic. Um, Three or more of these factors drops the survival rate to less than 5%. So that's just kind of have an idea in the back of your mind. All right, so let's talk about hypothermia. Um, Hypothermia is a big topic with drown victims because even if you're in the middle of summer, if you're somewhere, say, the Midwest, where there's not a lot of humidity in the air, a person is pulled out of the water and they can go hypothermic extremely quickly because all that humidity is pulled off of them and it pulls off the heat with them. So that can be extremely common. If you have drown victims in the fall or winter, um, that water can be ice cold, frigid, and it can cause hypothermia. If you have backpackers in the summer in the alpine lakes who are going diving or something for fun in those really frigid alpine lakes and hit their head, if they're in long enough, that can cause hypothermia. So hypothermia extremely common with drown victims, and here's some just kind of an overview of that for you to know. So starting with hypothermia symptoms. Mild hypothermia, so down to 93 degrees Fahrenheit. You start getting shivering, full body shivering, and the body's trying to warm itself up. Cold hands and feet, they can have extreme pallor in those extremities as well, and start having some pain in those extremities. They're usually still alert and capable, so they understand what's going on. And they're able to properly move around still, but they're starting to lose a lot of their dexterity. So they're not able to use fine motor skills, not able to hold on to a cup of warm water appropriately, not able to maybe properly grab onto stuff as they're trying to climb out of the water. And again, pain from that cold, especially in those extremities, fingers, toes, that sort of thing. As you get into moderate hyperthermia, so this is from 93 to down to 90 degrees Fahrenheit, the shivering decreases or it slowly stops. So when a person is extremely cold, but they're starting to shiver less or not shivering anymore at all, but they are still extremely cold, that's a worrying sign that you are progressing from moderate and then slowly getting into severe hypothermia. So severe hypothermia is under 90 degrees Fahrenheit and all the way down to 82 degrees Fahrenheit. So this is the majority of the 80s. Your shivering has stopped at this point. And then these individuals are starting to get a bit of an altered mental status. They're starting to slur their speech. They're denying there's a problem. There's something called paradoxical undressing. So people who are hypothermic often, for some reason, think they're hot and then start trying to strip their clothes. If their clothes are wet, that's not a bad thing. You can get them out of those wet clothes easier. But if they are in dry clothes, they can still be trying to strip those clothes, and that's a problem. And you wanna make sure to keep them from doing that. They start getting altercation again. They start wondering where they are, think that they're totally fine. They deny there's problems. Um, they can be semi-conscious. They can resist your help, try to shove you off, and then they're going to start getting a lot of muscle rigidity. So they're not going to have smooth dexterity. They're not going to be able to move properly. Everything's going to be kind of that rigid movements. So this is kind of where you're in the severe zone. Critical hypothermia is when you get under 82 degrees Fahrenheit and then anything under 82 degrees Fahrenheit. These individuals usually are unconscious or extremely altered. Usually they are unconscious though when they get to this point. They may even appear dead. Their respiration is slowed to a point where they're taking very shallow, very slow breaths in which they actually appear like they're no longer living. Their pulse may also be extremely slow and weak or even absent to palpation. The skin can be cold, blue, gray. They may have dilated pupils and an extremely rigid body. And so this is when they're in critical condition. All right, so let's talk about treatment for each of these areas. So with mild hypothermia, you mainly want to prevent further heat loss. You're trying to get warm, sweet drinks into them. No alcohol. Don't keep alcohol around them. Alcohol impairs your thermoregulation center in your brain, so you're not able to properly thermoregulate your body. So this can actually cause them to get even worse. And then you want to get them moving. Some mild, a light exercise. Just try and get them moving around, using their musculature to try and create some heat in addition to their shivering. As you progress into the moderate stage of hypothermia, again, this is when individuals are uh, are still having all those mild symptoms, but slowly stop shivering, but they're still very, very cold. You want to start limiting their exercise, and we'll talk about why in here in a minute. But basically, you do all the things you were previously doing, the warm, sweet drinks, preventing heat loss, but then you're not getting them up and moving around anymore. You're trying to keep them stable in one spot. As you get into severe hypothermia and down into the 80s, you want to make sure you're not jarring these individuals. So that, again, this is why we're saying about limiting exercise when you get into the moderate stages. When you're in the severe stages, you want to keep them as still as you can because one quick movements, hitting them on their back, them falling over anything can cause jarring to the entire body, can actually send them into cardiac arrest or ventricular fibrillation. And you could have a very, very serious problem on your hands that you are not equipped to deal with, especially if you're out in the backcountry. You're no longer giving these individuals food or drink, even more drinks. When they're in the severe stages, you're wanting to slowly lay them on their back and elevating their legs. So you're trying to get more blood flow to their brains. Applying mild heat packs to their head, neck, chest, and groin. And I didn't put on here, but armpits are great as well. So these are areas where the skin is thinnest and you can get the best kind of heat perfusion into the body. The head is actually one of the areas that you lose most of your heat. And so it's good to make sure you surround the head with a warm compress if you can. These individuals who are in severe hypothermia, you want to evacuate them as soon as possible because things could go badly and they need to be properly rewarmed in an emergency room. Critical patients, so patients who are under 82 degrees Fahrenheit. Many of you may have already heard this, but a patient isn't dead until they're warm and dead. So basically, even if the individual seems like they are deceased, they're cold, not moving, no pulse, barely or not respirating, you still assume that these individuals are revivable. We'll talk a little bit about protective hyperthermia in a bit, but basically a lot of these patients can be revived and pulled out of it because there is a mechanism of neurologic protection with this type of hypothermia. You handle, again, these patients with extreme care. You're in the same position here where you could induce a cardiac arrest or ventricular fibrillation if you jostle them too much. You're wanting to check their respiration and their pulse. If you can't find it, that doesn't mean they're not revivable. Remember that. But if you don't have any respiratory ventilation for 3 minutes, then you'll go ahead and start some rescue breaths. If you don't have any a pulse when you feel them, start CPR. Um, and basically, you're wanting to get them out of there as quick as possible. These individuals have to be rewarmed in an ER, and often, if they are in arrest, if you are able to warm them up to a certain degree, uh, and then get a shockable rhythm, then you can resuscitate them. So again, be extremely cautious with how you handle these victims unless they are no longer respirating or have a pulse. Start CPR, evacuate. Okay, so if you're in a rig or you have access to an EKG, I just thought something interesting you would want to see or review is what's called an Osborn wave. So this can indicate that the victim is suffering from a severe form of hypothermia in which you have an extra spike right after the QRS, and it's not quite long enough to be considered a proper T wave. And so you'll kind of get the bunny ears with the right hand side being lower, and you'll usually get them in the 3 through 6 leads. Okay, diving reflex. It kind of feels like we're jumping around a little bit, but this is all kind of getting you towards talking about the protective hypothermia. So diving reflex is basically a mammalian reflex that occurs when cold water hits the face. So we're talking about ice cold water. Often this reflex is utilized in patients in certain cardiac arrhythmias as well. But basically, it shunts blood and available oxygen to the heart and brain. So basically, when the cold water hits the face, it suddenly causes the body to say, hey, we need to protect the heart and we need to protect the brain. Shunts everything from the extremities to the heart and brain. It lowers the heart rate and it limits blood circulation to the body's core. So basically, if you have a person who has a tachyarrhythmia, you can use this reflex to slow down their heart rate. But we're talking about it in the sense of how it can lead to protective hyperthermia. Warmer water above 70 degrees Fahrenheit does not cause the reflex. Plunging other body parts into cold water doesn't trigger, but those of you who've jumped into cold water know that plunging your body into cold water can cause a reflex. Deep breath, which again can cause asphyxiation if you breathe in any of that water. It also should be noted that children younger than 3 years old exhibit the reflex more dramatically, which actually enables some children to survive for an unusually long period of time in cold, frigid water. So you can actually resuscitate young children much further out than actually adults. So this all kind of ties back into protective hypothermia. So, because of the diving reflex, near drowned victims have been revived as long as 1 hour after being immersed in cold water, even if they no longer had respiration or circulation. The chances of surviving depend on the water's temperature. The colder, the better, because the quicker you induce the hypothermia, the more protective it is. The length of time they've been underwater, their age, again, the younger, the better, because they have that stronger diving reflex, the younger they are. And then also what kind of rescue efforts were to survive them or to revive them. It should be noted that protective hypothermia has to occur simultaneously with drowning. If a person drowns before they become hypothermic, which we're talking about the critical, severe to critical hypothermia right now, if they drown before becoming hypothermic, they don't have that protective hypothermia that protects neurologic function, and they just drown. So the way you get protective hypothermia is if you become hypothermic and then you drown. So essentially, you get that neurological protection before any of the water aspiration or any of the organs shut down. So you get that protection of the cardiac system, the neurologic system, and then when you eventually do go into respiratory cardiac failure, you have that protective mechanism that can allow for reviving for longer periods. So these patients are usually going to be drowned victims who are drowning in the middle of winter, falling through an ice hole, or something along those lines. Cold water death. So immersion syndrome, basically the victim dying upon contact with cold water. This is more in adults, especially older adults, because the sudden cold water can actually induce cardiac arrest. So we talked earlier about sometimes ice cold water on the face actually being used to induce lowering of heart rate for victims suffering from tachyarrhythmias. Well, you can lower this heart rate too much and causing and inducing cardiac arrest, especially in older individuals. In very cold or freezing water, the reflex reactions can be lethal. It can kill up to 70% of people within 15 to 30 minutes. Again, these are older individuals who don't have as strong a diving reflex or who have prior conditions. They can also get cold shock, which is basically a combination of uncontrolled gasping and massively increased blood pressure. Um, you can also rapidly lose control of all bodily functions needed for swimming before you get that hypothermic protection, and then drown before you actually have any of that neurocognitive protection. So cold water isn't always protective, especially if, again, if you drown before you become hypothermic, and the cold water can actually induce you to drown faster or cause cardiac arrest. That's basically why I want you to take away from this. So this is just kind of an overview of cold water immersion and kind of the process. This is something you can go over in your own time, but basically it goes through all of the different physiological reactions to cold water immersion. But I'll go through the basic phases. So phase one is the cold shock response, so your dive reflex. So again, you are shunting blood from the periphery, from the core to the heart and brain, trying to protect cardiac and neurologic function. Phase two is cold incapacitation. This is 5 to 15 minutes. Again, be even faster depending how frigid that water is. Again, this is where your musculature shuts down. Early on, your fine dexterity goes out the window, and then later on, you get extreme muscle rigidity in your entire body. You're no longer able to tread water. If you don't have a flotation device, you will drown. I know everyone's head right now is going to the Titanic scene of Jack in the water. And yeah, basically gets to the point where you can't even pull yourself out of water. You can't move. Phase three is the onset of hypothermia. So this is if the individual has yet to drown, whether they're on a flotation device, have been able to float in the back, whatever, they haven't drowned yet, and you're starting to get onset of hypothermia in that protective hypothermia. This is around the 30-minute mark or more. But if you're in ice cold water, say you fall off of a ship and there's icebergs around, or you fall through an ice hole, this hypothermia can set in in less than 15 minutes. So you can get that protection even quicker. But you also end up getting the cold incapacitation quicker. So unable to move, this could happen in mere minutes. And that cold shock response is probably going to be even more intense. So if you're an older individual, it can cause those detrimental responses, the immediate incapacitation or the cardiac arrest. Phase four is circumrescue collapse. So this is when you have gotten someone out of cold water and you're trying to rewarm them, whether in a rig, in the ER, on the beach with warming packs, whatever. You can actually get something called rewarming shock. So this is an after drop in blood pressure. So when you start rewarming them, you actually get vasodilation and causing shock and circulatory pressure collapse. This can also induce ventricular fibrillation, which can eventually lead to arrest, in which the victim can die. So rewarming shock is something you want to be acutely aware of when you're treating victims in any setting of hypothermia, and monitoring their blood pressure very, very closely. So, rewarming. Your goal is cardiorespiratory stabilization and minimizing the afterdrop, so that blood pressure decrease that can eventually induce shock and cardiac arrest. So, your first goal is to prevent further heat loss. So, if they have cold clothes on, you're cutting off the clothing, you're blotting the skin dry, again, not rubbing them. You don't want to induce VFib or arrest. Then you're insulating them with warm clothes, blankets, whatever, heat pads, again, in those locations we talked about earlier, the head, the armpits, the groin, and the neck. And then you're also wanting to put a layer over them that is insulatory and windproof, especially if you're out in the backcountry and you're still exposed to the elements. Putting a windproofing layer over can help tremendously. Once you get into the emergency room, you can also start a couple of other things to start getting the victims warmed up. So something called inhalation warming, which is basically warm mist masks that you put over their face, have them breathing in warm air. This can start warming them quite quickly, especially in the thorax. You want to shove in some warm IV fluid, so either D5 or normal saline. You start with the 300 to 500 rapid bolus. Hopefully, in the rig, they started 2 wide bore IVs. But again, these victims, it can be extremely hard to get a peripheral line going. So you may have to do a central line or a jugular venous access to be able to get a proper line in them. Again, because they have, if they're hypothermic, their vessels in their periphery uh, often will be collapsed down or constricted so heavily you can't get a line in. So that's something to keep in mind if the rig couldn't get one in. Having your staff on standby to put either a central or a jugular line in. Again, you put 300, 500 milliliters rapid and the rest of the liter over an hour. This is warm IV fluids. There's also something called warm peritoneal lavage, where you warm the peritoneum with IV fluids. That's not really practiced anymore. Mainly you're doing inhalation warming, warm IV fluids, and then putting heat packs in the groin, neck, head, and axilla. All right, some other things to keep in mind. You do not want to give lactated ringers. You want to give D5 or normal saline if you're in the emergency room, because a hypothermic liver cannot process the lactate and you can further increase their acidosis. Never give cold fluids. So if you do not have warm fluids on hand, you do not want to give cold fluids. You can further their hypothermia. Their shivering response, which actually shivering can reach levels that are 5 to 6 times that of the resting metabolic rate. So that's why shivering is your first way of trying to rewarm yourself. But the shivering can decrease your glucose stores. So if they are able to take things PO, give an oral glucose solution as well to replete those stores. All right, so this slide is just kind of a breakdown of everything we've talked about, whether you're in the field post-rescue trying to rewarm or you are in the emergency room. So this is just kind of the layout of how you're assessing them and what to do. So this is a quick review if you want to print out the slide and have it with you. It's the quick and easy breakdown of what to do. So with that said, thank you guys for listening today. Again, my name is Alexander Hetrick, fourth year at Rocky Vista University. This is my contact information if you have any further questions. Also, if you have any updates, because again, medicine isn't stagnant. We're always having new findings, or if I missed anything, which is entirely possible, please either leave it in the comments or send me an email so I can update the slides. My references are here if you want to go do any further research on your own. And other than that, thank you for tuning in, and please join us for our next video, which is on diving medicine.